Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my YouTube channel Science for Everyone. Today the video is related to virology and the title of my today's topic is that how virus reaches baby in a mother's womb. In simple words, this means that, for example, if there are certain viruses, specific viruses, that when the mother is infected and she's giving birth to a baby, or she's pregnant, so the virus can enters the baby, the infant, and there are certain conditions when she is giving birth to the baby, so even the virus can come in contact with her baby, and the baby can also be infected. So in this video I will discuss that the overview, the schematic diagram of it, that how the virus enters the baby, and at the last I will show you that which viruses are specific for these transmission, that not all the virus can enter the baby. There are certain specific viruses that can enter the baby when he or she is present inside the mother's womb. And I will also show you, give you the examples of the virus, that for example if the baby is born, so after when he or she is feeded by the mother through her breast milk, so the virus can enter the baby through breast milk. Okay, so stay tuned and watch the video till end, so you will get all the information related to this topic. So it is a type of informative video, and share it with your friends also, so they can also get information through it. Okay, so let's start with the video. First of all, this is a schematic diagram that we will start it from the very beginning, that for example this is a virus. Okay, a specific virus that and for example a woman that she is pregnant, she's infected. Okay, so let's first we will start from here. Okay, this one number, for example when she is infected, so viremia can occur. Okay, most of the viruses can enter the bloodstream. So when viremia occurs, so after that it can cross the placenta of the mother, and it can get entrance, or it can get access to the fetus. Okay, and when it get access to the fetus, so what will happen, that the fetus will all be infected. So the first condition is that, for example if there is viremia, so what will happen, it will cross the placenta, and it will enters the fetus. Okay, if I show you a specific example of it, so just look here about the example. For example, this is a fetus. Okay, this is fetus inside the mother's womb, and this is the placenta. And just this is the zoom picture of the placenta. Just look here, this is the placenta, and these are the arteries and the veins of the placenta. And here to the umbilical cord, these blood vessel can get access into the to the baby, and these blood vessels are used for the nutrition, and different nutritive components and substances can enter the baby, and the baby get nourishment. So when the virus enters the bloodstream, so it can easily get access to the baby with the help of these blood vessels, and it can enter the fetus. Okay, it is a little bit more detailed diagram, zoom diagram. You just look here, this portion is getting entrance into the baby. Okay, this portion is a little bit zoom one, so it can just look here, these are the arteries and the veins. And when here is a virus, so what will happen, that it can easily get entrance to the baby, and the virus can come here. Okay, so I was just telling that because of the viremia, when there is viremia in the mother, so through viremia it can easily get entered to the fetus. Okay, so this is the first condition. Keep this condition in your mind. Okay, so this was number one. And after that, the second one is that, okay, so if there is fetal infection, so there are four cases that the fetus can survive the infection, and the immune system that is present inside the fetus, it is not that much advanced, but it can kill the virus, and the fetus can be normal. Second, that when it is he or she can be infected, okay, and when it is infected and when it is born, so there will be an infection, and after that it can also lead to death, okay, the death of the fetus, okay, if there is a very high number of viruses and the virus is a strong agent, so it can also kill the fetus, okay, and abortion can be done in stillbirth. These all are the condition. So death can also occur, and other is that malformation. Fetus will be born, but he will be not in his pure condition, and when he is born, so directly he will die. Okay, either he will survive or die, but the most cases that it is the malformation of it. He will be having different syndromes and different high amount of symptoms, okay, so there are four conditions: either he will be normal, he will be infected, he will be killed inside the mother womb, and if he is born, so he will be having different deformalities, okay, so keep these four conditions in your mind. The second condition is via vagina, okay, via vagina there are certain UTIs, urinary tract infection, that is just because of the bacteria. I'm not talking about that, but the virus can also enter through vagina. Okay, so they keep this thing in mind that if a mother is pregnant, so she should take care of her cleanliness. Okay, she should avoid unhealthy activities. Okay, so the virus can enter the vagina and it can infect the fetus. Okay, it can infect the fetus, but here keep this thing in mind that here the infection is not through placenta. Okay, in the case of viremia, it was through placenta. Okay, because the blood vessels were connected with the fetus through the placenta. So in viremia, placental infection can occur, but through vagina, what happens when the virus enters the vagina? So what happens, I will show you in a diagram. Just look here. Now here is the amniotic sac. Okay, the through vagina, just look here, I will draw. This is the, okay, this is the vagina, and when the virus enters here, so it will get entrance to the amniotic sac, okay, amniotic fluid. So here will be the virus, and here it can enter the fetus through the nose or through the mouth or through the skin, okay. So if there are certain pores in the skin or other such type of thing, so the virus can easily get entered, but here it is not through placenta, it is through amniotic fluid and amniotic sac, okay, and this is when it get entrance with the help of the vagina. So keep this second condition in mind, and all are the four conditions that when the virus enters the fetus, so it can cause even the fetus can survive, he can kill the virus, or he could be infected, he could be killed inside his mother, or if he is born, so he will be malformed, either he will then survive or not. Okay, so keep these two conditions in your mind. Okay, this is the first condition and this is the second condition. The third condition is, and it is very much type of specific, and most of the cases leads to death. Okay, so here is the that this infection can occur when the fetus is forming in the at the time of formation. Okay, so the ova can be infected. Okay, and after that when, for example, there is a chronic condition and the mother is infected for a long period of time by the by the virus, so the virus can enters the can infect the ova of the mother, and if it is when it is fertilized, so the ova is infected. So when there are the cells are dividing, so the virus is also dividing in each and every cell, so all the fetus can easily be infected. When the fetus is formed inside the mother womb, so then what will happen, he or she will be having the virus inside him. Okay, so even there will be, so but most of the cases the fetal death and the malformation. So these are also the four conditions. So this is the third condition, that ova can be infected. Okay, so and keep this thing in mind that through uh, there are that most of the cases is that when a baby or a fetus is infected by a virus, so it can lead to a normal fetus or a spontaneous abortion. So these are most cases, but the most cases is the spontaneous abortion, because the the immune system of the baby is not well developed, so that's why a spontaneous abortion occurs. Okay, so hope you have understand about the route of transmission of the virus through mother. Okay, now here are the examples of it. Okay, I told you in the previous first part of the video that I will show you different viruses that are included in these categories. Okay, so just look here. If we look here to the rubella virus, so rubella virus, it can be prenatal. Okay, if prenatal means before when the baby is delivered into the this world. Okay, so before the pregnancy, before the delivery, it is basically prenatal. So rubella can easily infect the baby inside the mother womb, and those I have discussed the schematic diagram of it. Either it will be via viremia, either it will be by by the vagina, or it will be from the ova. Okay, and during delivery, most of the cases when there is delivery, so the umbilical mostly the mother the mother's blood came in contact with the fetus. Okay, so during that time, and even the fetus when he is born, so his mouth is opened and the virus can enter into his mouth. So different conditions are there. These are all the clinical conditions when the mother is giving delivery to the baby. There is breakage of amniotic sac. So mostly the virus can come in contact with the fetus. Okay, so during the delivery, rubella cannot infect the baby. Just keep this thing in mind. It will be necessary for the MCQs. Here, postnatal, after delivery, the condition is a little bit rare. After delivery means that either this virus is present in the mother's milk or not. So mostly the rubella virus is present in the mother's milk, but in rare conditions. Okay, so it is rare. And here is a neonatal incidence per 100 live birth. It's a type of statistic that out of 1,000 babies, 0.1 to 0.7 percent babies are infected through this rubella. Just look here to the cytomegalovirus. So it is a type of herpes simplex virus, and here it can infect the baby that is present in the womb, and it can during the delivery there is a double chance that he or she can be infected at the time of delivery with the cytomegalovirus. And this cytomegalovirus is also present in the mother's milk. So when the mother is infected, so she can easily pass the virus through the milk, through her fetus. Okay, so keep this thing in mind. And there is 5 to 25% of babies in 1,000 that can be infected. Here is the herpes simplex virus. So this is also it is also having chance, and this is double chance. So just compare all the viruses of it. Okay, that these are the viruses. I have taken it from a very authentic microbiology book, medical microbiology, that was produced by the McGraw Hills Associations. Okay, so this is a type of informative. So it is an informative video. If a mother is infected, so she should get cured from it, because her baby is at risk. Okay, so this was all about the today's video. Okay, if you have any question related to this video, so you can ask me in the comment box. I will answer you there. Okay, and thank you for your attention. Thank you very much. God bless you.